I do get dizzy with it from time to time.
I experience dizziness a lot.
I experience quite a bit of dizziness, but I don't find it disabling.
If I get overheated doing aerobic exercise, I get dizzy.
And as I'm falling asleep, the room is usually, even with my eyes closed, it's spinning.
Dizziness is a common symptom of MS. People with MS may feel off balance or lightheaded. Less often, they have the sensation that their surroundings are spinning, a condition known as vertigo. Hi, I'm Kate Milliken and welcome to MS Learn Online. To discuss these symptoms, we have Dr. Stephen Krieger. Dr. Krieger is a neurologist at the Corin Goldsmith Dickinson Center for MS and an assistant professor at the Mount Sinai Medical Center, both in New York City. Welcome to MS Learn Online, Dr. Krieger.
Thank you.
So, is there a difference between dizziness and vertigo?
There is. Dizziness is a very broad term, common term, and people use it to mean a lot of different types of things. Vertigo, on the other hand, as you mentioned in your introduction, is a very particular description of a sensation of movement where there is no movement. And most often, it's a sensation of spinning when the person is not, in fact, spinning. Some patients can experience vertigo as a feeling that they are spinning around. Other times patients will describe it as the room is spinning around them. But that feeling of movement, and spinning in particular, is what is very specific for vertigo. Dizziness, on the other hand, can mean a lot. It can mean lightheadedness. It can mean vertigo. Some patients will describe this when they're, let's say, have low blood sugar or low blood pressure. They might feel this when they're tired and say that they feel dizzy to mean they just sort of feel that they can't do it anymore. So when somebody talks about dizziness, the first series of questions that the neurologist will ask are to try and understand what do they mean by dizziness, and do they in fact specifically mean vertigo.
Are there any additional considerations you'll take after that initial inquiry about the dizziness on how you're going to treat it?
Well, it really depends on what they mean and what the root cause of it is. Vertigo is more concerning in a sense as a true neurologic symptom, whereas dizziness or lightheadedness can mean a lot of things which would need to be approached by looking at blood pressure and blood sugar and things of that nature. But if there is evidence from the history of true vertigo, true spinning, there are things that a neurologist will look for on the clinical exam and considerations that the neurologist may take with a workup to understand where that vertigo is coming from.
Do you know where lesions are forming in the central nervous system when a patient comes to you and says they might be dizzy or have vertigo?
Interestingly, yes. There is in general a somewhat poor correlation between MS lesions and MS symptoms. That can be a somewhat a frustrating thing for both patients and physicians and when they're trying to put together a diagnosis. But vertigo is actually very specific. When vertigo is coming from the central nervous system, it is coming from a particular place in the brain stem, which is responsible for balance and coordination. That area of the brainstem is actually right next to an area of the inner ear, which sends its signals. And so one of the challenges when looking at vertigo is to figure out if it's vertigo from the central nervous system, from the brainstem, or vertigo from the inner ear. And anyone who's experienced a sinus infection or seasickness and feels dizzy and vertiginous in that way understands how the inner ear can contribute to feelings of vertigo. So that is what the neurologist really needs to try and figure out. Is it an inner ear problem causing vertigo, which might be treated in a different way than a lesion from MS causing vertigo, which would be in that very specific area in the brainstem.
Are there any management approaches that you would recommend for somebody that comes to you with these symptoms?
Well, first of all, I would say that if someone is experiencing vertigo, they should let their physician know, either their general practitioner or their neurologist, because it is a somewhat complex symptom to figure out, and it can be very unpleasant and should be looked at. Vertigo can sometimes be associated with nausea and with vomiting. Sometimes people will feel that they barely can stand up and have to hold on, and it does prompt visits to the emergency room at times. The management approaches really do require knowing what's causing the symptom. And so I would hesitate to tell a patient to do anything else about their vertigo or dizziness until they've talked about it with their doctor. There are some medicines that can help to treat vertigo. These medicines are really designed for vertigo from the inner ear. and there are medicines that are not unlike those that are used for seasickness that can help with that symptom. They are somewhat less effective when the vertigo is coming from the brain stem if it's caused by an MS lesion. The good news there is that that is often signs of an MS relapse or an MS attack. And I say good news because those are usually self-limited. We can treat MS attacks with steroids and make them resolve more quickly, but someone who's experiencing vertigo will not be doomed to experience that forever. It will be a self-limited experience.
Dr. Krieger, thank you for writing us on the subject of dizziness.
Well
If you
said.
would like to get more information on symptoms of MS, go to nationalmssociety.org. This is Kate Milliken for MS Learn Online. Thank you for joining us.
For dizziness, actually, I like to do puzzles because it keeps my eyes moving, and as long as my eyes are moving, I don't tend to have the dizziness like I have if I'm just sort of watching TV.
If I get dizzy, I've got my cane to keep me stable.
I find that if I'm in motion, I have less dizziness.
If I want to go out and I want to, have some time with my dog or anything like that, I use 2 canes to balance off each other, and that helps a lot with the dizziness and the lack of balance.
It's just part of my day-to-day life, so it's not something that stops me from doing things.